Welcome to Epoch News. I'm Tatiana Darzi. In the data received yesterday, the numbers from two countries stood out. One is the zero hospitalization rate in Wuhan, and the other is the zero confirmed cases of the virus for 15 consecutive days in Taiwan.
For 14 days leading up to April 26, Taiwan had no new confirmed cases of the CCP virus. The public is concerned about the possibility of loosening preventative measures. Minister of Health and Warfare Chen Shih-chung expressed that the Ministry of Health and Warfare is now discussing this possibility using related scientific data. During a financial relief program project meeting on the CCP virus pandemic report, a question about the end of the pandemic in Taiwan was asked, to which the Minister of Health and Welfare replied,
"Assuming there are no surprises, will the epidemic end before the end of June?
It is possible.
Will the epidemic come back again?
If the antibodies mentioned by the WHO are not as effective as we expected, then they might not be useful in the development of the vaccine. Therefore, it is inevitable that the epidemic will return in autumn and winter."
The antibodies provided by the WHO are ineffective. As a result, Minister Chen Shih-chung is worried about having a long-term fight against this epidemic.
In your opinion, should social distancing continue until the end of this year or until next year?
It may need to be normalized. A stable circumstance will only become a reality when the drugs are available.
Taiwan has had no new confirmed cases for 14 consecutive days, and it is understood that the CDC is planning to loosen some preventative measures, such as social distancing, restriction of hospital visits, and business activities. However, the officials emphasize that scientific data will be needed and used to further assess the condition.
All preventative measures are being discussed, not limited to our 3 phases preparations. When the situation improves in the future, we will do certain preparation for lessening the preventative measures based on the scientific evidence. I hope the good situation continues to keep up, and everyone continues to be cautious but not overly nervous.
As the Labor Day holiday approaches in Taiwan, Minister Chen expressed that he does not encourage people to go out for shopping, but that it is not forbidden to do so. As long as preventative measures are taken properly, citizens having a normal or semi-normal life is totally possible. He then added,
We were a little happy to see the epidemic showing signs of slowing down, but the real situation is even more intense as everyone knows that it is not easy to maintain a 0 new confirmed cases under a normal circumstance because any potential risks exist.
As the epidemic in Taiwan slows down, the CDC is still on the lookout for any possibilities, and there is no room for negligence.
In China, Ms. He's father became severely ill and was taken to the hospital. The hospital staff then decided to transfer him to another hospital without notifying the family beforehand. His situation worsened in the second hospital, and he was placed in the ICU on a ventilator. He was given a nucleic acid test to determine if he was infected with the CCP virus, and the results came back negative. Ms. He learned from a friend that her father too was transferred between the same 2 hospitals, also without the family's knowledge or consent.
Ms. He, a Wuhan resident whose father is severely ill with the CCP virus pneumonia, commonly known as Wuhan pneumonia, recently tried to seek help on the internet. Although her father is still in the ICU department on a ventilator, his nucleic acid test came out negative for the virus. The hospital told her that based on this negative result, her father's treatment is no longer free. Her family has been charged 50,000 yuan, or $7,060, as a result. Her father was originally hospitalized in Jinyintan Hospital, an infectious disease hospital and the very first hospital to provide treatment for the CCP viral pneumonia. Chinese authorities publicly announced that there are 0 severely ill CCP virus patients in the ICU department of Jinyintan Hospital. They're claiming it's a sign of victory over the pandemic. However, Ms. He revealed that's because all the severely ill patients, including her father, were transferred from Jinyintan to another hospital.
No one notified us when my father was transferred to Zhongnan Hospital. Zhongnan Hospital called to tell us about it only after the transfer was completed. The reason he was transferred was not because he had improved or was in need of certain special treatment. It's a requirement from above that severely ill patients be transferred to other comprehensive hospitals. I communicated with a friend of mine yesterday. His father was also a severely ill patient. He was also transferred from ICU of Jingyantan to Zhongnan Hospital the same day. He too was not notified before the transfer. The hospital authorities transferred patients without getting approval from us first. Shortly after he was transferred to Zhongnan Hospital, I was told that, based on his nucleic acid test result, he no longer qualifies for free treatment. You have to pay for the treatment. If he has health insurance, the insurance can cover up to 70% of the cost. However, they called me again yesterday saying that previously, the treatment at Jingyantan Hospital had cost 630,000 yuan and used up all his health insurance allowance, which was 540,000 yuan. So Jingyantan already charged his insurance company 540,000 yuan, and all the cost in the new hospital will be on us. I then checked my father's nucleic acid test results. The first negative result came out at Jingyantan Hospital, and the new policy states that those who test negative can no longer receive free treatment. I consulted a doctor yesterday. He said, "Your father has been on a ventilator for a month. Although the nucleic acid test came out negative, the infection is still there in the lungs. The key indicator of recovery is the recovery of lungs. Your father is still on a ventilator and is still a severely ill patient. How can they exclude him as a coronavirus patient and stop free treatment? Now I will demand they show me the official policy and ask them, what is your basis for saying that the treatment is not free? My father has been in this hospital for just a week, and they rushed to demand payment from us, an initial payment of 50,000 yuan for the treatment."
One of the unusual features of the CCP virus is the difficulty in diagnostic tests. There have been numerous cases in which the CT scan of a patient's lungs shows serious infection, but the nucleic acid test is negative. In the case of Ms. He's father, the hospital is taking advantage of the false negative diagnostic result to deny free treatment for her father. The interview was conducted on April 22nd by Hong Ning of the Chinese language Epoch Times.
China has threatened to boycott tourism and foreign trade with Australia after Australia, together with other countries, have called for the Chinese regime to be held accountable for the pandemic. Despite the threat, Australia is not backing down.
Many countries are demanding reform within the WHO and have called for the CCP to be held accountable for the pandemic. Australia, being one of the most vocal countries, has been threatened by the CCP with a boycott in tourism and foreign trade. The Foreign Minister of Australia said Monday that he would not submit to the coercion. As of April 27th, the number of confirmed cases of the CCP virus in Australia reached 6,714, with 83 deaths. Australian Prime Minister Scott Morrison, Home Affairs Minister Peter Dutton, and Foreign Minister Marise Payne recently called for the international community to send independent inspectors into China to investigate the actions taken by the Chinese Communist Party since the outbreak of the virus. Tom Connell, a journalist with Sky News Australia, said,
"Yeah, it's a very united push, one for a global independent inquiry into COVID-19. Now, clearly that would focus on the role of the World Health Organization and also the role of China, what the Chinese Communist Party knew and when and what was done to try to suppress the virus, or perhaps in cases, what was not done."
The Australian Financial Review reported on the 26th that Cheng Jingye, the Chinese ambassador to Australia, said Australia's pursuit of an independent investigation into the coronavirus pandemic was dangerous and could spark a boycott of students and tourists visiting Australia, as well as sales of popular agricultural products, exports such as beef and wine. However, Australia did not back down. Sky News Australia anchor Laura Jays said,
"The government is not backing down from a push for an inquiry into China's handling of the coronavirus, despite a threat from the Chinese ambassador."
On the 27th, Foreign Minister Marise Payne responded to Cheng Jingye, saying that Australia's call for an independent inquiry into the CCP virus comes at the right time and is a principled call. She added, "This is an unprecedented global crisis that has serious health, economic, and social implications. We reject any suggestion that economic duress is appropriate to respond to calls for such assessments. What we need at this time is global cooperation. British Defence Secretary Ben Wallace also expressed his support for the Australian call for an investigation into the CCP virus outbreak inside China. He said that during this once-in-a-century event, the world needs transparency and every government needs to learn the lessons presented by this event.
Taiwan has donated 6 million surgical masks to countries worldwide. Germany and the United States have received 1 million masks each, with 10,000 of the U.S.-bound masks being sent to the state of Massachusetts. Taiwan's generosity and compassion sharply contrast that of the Chinese Communist Party's behavior and poor quality of exported materials. U.S. Secretary of State Mike Pompeo highlighted how the Chinese regime is exploiting nations while the world suffers from the pandemic.
As of April 25th, Taiwan has reported 429 confirmed cases of the CCP virus pandemic, 6 deaths, and 275 people out of quarantine. Taiwan has initiated a second international donation of 6 million surgical masks. Michael Roth, Minister of State for Europe at the Federal Foreign Office, publicly thanked Taiwan for donating to Germany 1 million masks. In addition, the United States has also received 1 million masks, with 100,000 sent to the state of Massachusetts, which showed its gratitude toward Taiwan.
Taiwan is a democratic country, and the question is not just whether Taiwan needs the WHO, but maybe we need Taiwan to join the WHO too.
We have communicated with the WHO, who has promised to include Taiwan in WHO's daily pandemic prevention platform.
Taiwan delivered 1 million masks to Germany last week. This is what we desperately need, and I think it is very generous of Taiwan to do this.
The video came from the Taipei Representative Office in the Federal Republic of Germany. Moreover, 22 European members have also written to the Foreign Minister of the European Union, calling for Taiwan's full participation in the WHO. The second donation of 1 million masks to the U.S. has arrived. The state of Massachusetts expressed gratitude to Taiwan for receiving 100,000 masks.
And it's my honor to be here today to represent the Baker-Polito administration in accepting the donation of 100 surgical masks from the people of Taiwan to the Commonwealth of Massachusetts. They not only make the masks, but they deliver them as well, which we're very grateful for.
In the Asian Pacific, I think Taiwan is the leading country that has been fighting this virus and had so much success. And there's much to learn from each other.
U.S. Secretary of State Mike Pompeo indicated that the Chinese Communist Party took advantage of the pandemic to continue its provocative actions, including arresting Hong Kong democracy advocates and exerting military pressure on Taiwan.
I want to highlight 2 ways in which the Chinese Communist Party is exploiting the world's focus on COVID-19 crisis by continuing its provocative behavior. First, we commented on what's taking place in Hong Kong, more amidst increased efforts by Beijing to erode autonomy. Law enforcement authorities have arrested pro-democracy activists, including 81-year-old Martin Lee.
Last Saturday, Hong Kong police arrested 15 pro-democracy activists belonging to different political parties and organizations.
You've also seen that the Chinese Communist Party is exerting military pressure on Taiwan and coercing its neighbors in the South China Sea, even going so far as to sink a Vietnamese fishing vessel. The United States strongly opposes China's bullying. We hope other nations will hold them to account too.
As of April 10th, according to information publicly disclosed by the Ministry of National Defense of Taiwan, the Chinese military aircraft have been spotted 6 times this year in waters adjacent to Taiwan. The Liaoning military ship carrier formation also appeared in eastern Taiwan waters on April 12th. In Taiwan, the epidemic continues to develop after 31 soldiers and officers tested positive for the CCP virus on the Banshi warship. The travel and contact histories of the confirmed cases are being traced on a large scale. They are estimated to have been to more than 30 locations across 9 counties. Text messages have been sent out to alert the public. The close contacts and travel history of the soldiers and officers are being urgently investigated to avoid another wave of community spread. For those places that have been exposed to the confirmed cases, people will not be allowed to exit and the buildings will be disinfected.
Scientists at the health departments in New York City have started to analyze the CCP virus's genetic material. The CCP virus genome consists of a single short strand of ribonucleic acid. As the virus replicates itself inside a host, it can alter its genetic material. According to the city's health commissioner, the genome sequencing could help blunt any second wave of infections in the year.
Inside New York City's public health laboratory, scientists not only test for who has COVID-19, they have also begun analyzing the genetic material of the novel coronavirus to allow them to trace the origins of any future outbreaks. The genome sequencing effort could be key to blunting future infections, New York City Health Commissioner Dr. Oxiris Barbeau told Reuters.
We can use that fingerprint information to understand if those additional infections are due to infections that were still here in the city, or if they've been imported from someplace else.
The genome of the novel coronavirus consists of a single short strand of RNA, a distinctive sequence of genetic-based molecules that the virus uses to hijack its host. Once inside the host, the virus replicates itself, sometimes making tiny transcription errors and altering its genetic signature. These mutations can be passed along in subsequent infections. Tracing them can then create a sort of genetic family tree. Scientists at NYU Grossman School of Medicine, who have also studied the virus's genome, deduced that the variant of the virus dominating New York City, the heart of one of the deadliest outbreaks, arrived via Europe. Researchers said that looking at variants of the virus may also help shape a vaccine that offers the broadest possible protection against the disease.
Yesterday, President Trump stated that the U.S. has conducted 5.4 million tests. That's twice as any other country.
We've launched the most ambitious testing effort, likewise, on Earth. The United States has now conducted more than 5.4 million tests, nearly double the number tested in any other country, more than twice as much as any other country.
The CCP virus testing being developed by Abbott Laboratories gives results within 5 minutes.
The testing that's been developed and being developed right now has been truly an amazing thing. I want to thank Abbott Laboratories for the job they've done. I want to thank Roche, and in particular, those two have really stepped forward. Abbott with a 5-minute test that people can take, and in 5 minutes they know what the answer is.
President Trump goes on to state that there have been a lot of unnecessary deaths in the country and around the world that could have been avoided.
So thank you all very much. It's incredible what we've done together over a short period of time. I want to thank our Vice President for the task force and the work. Every day it gets better, and we had a fantastic call with the governors today. And I would say that they are as thrilled as they can be, considering that the fact is that there has been so much unnecessary death in this country. It could have been stopped, and it could have been stopped short, but somebody a long time ago, it seems, decided not to do it that way, and the whole world is suffering because of it, 184 countries at least. But I want to thank all of these great business men and women for the job they've done. They've been fantastic with us, working with us.
The following charts will show you the most recent numbers regarding the CCP virus pandemic. However, China and Iran are not included because their numbers are unverifiable. Yesterday, a CCTV news anchor had accused U.S. Secretary of State Mike Pompeo for what she called the spread of the political virus. Stay tuned. We'll have that video out for you here on the Epoch Times YouTube channel, today at 5 p.m. Eastern Standard Time. That's all for today. Don't forget to like, subscribe, and share this program with friends and family to keep them informed about the latest news and updates. Thank you for joining me. See you next time.